Hello, this is Dr. Sam from Sam Agency for OET Services. Today we will take an overview of OET, and after that we'll start with the phase subtest, which is the listening subtest. As we all know, the OET has 12 versions, but in our camp we can cover the medicine, dentistry, nursing, radiography, physiotherapy, and pharmacy versions. First of all, let's talk about the OOT components. The OOT has 4 subtests. The first one, the listening subtest, which will last for about 45 minutes. And in this subtest, the content of this subtest is the same for all healthcare professions. And you have to follow and understand a range of health-related spoken materials such as patient consultations and lectures. The second subtest is the reading subtest, which will last for an hour. And also the content there is the same content for all healthcare professions. And here you have to read and understand different types of text on health-related subjects. The third subtest, the writing, which will last for about 45 minutes. And this subtest is specific to a profession. So it's specific to a profession based on typical workplace situations. The writing subtest, you have to write a letter. So the task is to write a letter, usually a referral letter. Sometimes, especially for some professions, a different type of letters is required. For example, a letter of transfer or discharge, or a letter to advise or inform a patient, care, or group. The last subtest we have is the speaking subtest, which will last for 20 minutes. And also it's the same for writing. It's specific to profession and based on typical workplace situations. In this subtest, you will be in a private room and you will take part in 2 role plays. And you take your professional role as a doctor or a nurse, etc. While the interlocutor plays a patient or client or sometimes a relative or carer. The interlocutor means the OOT representative, not the OOT assessor, okay? Let's start with the listening subtest structure. The listening subtest has 3 parts. The first part is the part A, and here you will have 2 consultation extracts, about 5 minutes each. In part A, assesses your ability to identify specific information during a consultation, and you will listen to 2 recorded health professional patient consultations, and you will complete the health professional's notes using the information you hear. While in part B, there are 6 short workplace extracts, about 1 minute each, and you have to here this part will assess your ability to identify the detail, guest opinion, or purpose of short extracts from the healthcare workplace, not to identify a certain word. Okay, so be careful here. After that, you will listen to 6 recorded extracts like team briefings, handovers, or health professional patient dialogues. And you will answer 1 multiple choice question for each extract. The last part in this subtest is the part C. In part C, there are 2 presentation extracts, about 5 minutes each. Part C assesses your ability to follow a recorded presentation or interview on a range of accessible healthcare topics. And you will listen to 2 different extracts and you will answer 6 multiple choice questions for each extract. So the sum of questions in each part here, 24 questions, while here 6 questions, and part C, 12 questions. The second subtest is the reading subtest structure. The difference here is that a reading subtest its first part, for part A, it will be settled in the first and in a separate setting. Okay, so at the beginning of the reading subtest, you will start this subtest with part A separately, and after that they will collect the answer booklet, and after that you will start a new setting with part B and part C. So it's not like the listening subtest, which its parts will be given in one single setting. So the reading subtest in part A, it's an expeditious reading task. This means it's a fast reading task in 15 minutes. And here it will assess your ability to locate specific information from 4 short texts in a quick and efficient manner. The 4 short texts related to a single healthcare topic, and you must answer 20 questions in 15 minutes. So the 20 questions will be given in a 15 minutes only. The 20 questions consist of matching, sentence completion, and short answer questions. So these are the types of questions in the reading part A. While in part B, it will assess your ability to identify the detail, gist, or main point of 6 short texts sourced from the healthcare workplace with a length of words. It's about 100 to 150 words each. The text might consist of extracts from policy documents, hospital guidelines, manuals, or internal communication such as emails or memos. For each text, there's 3 option multiple choice question. So the MCQ here is consists of just 3 options. While in part C, it's a 4 option multiple choice question. So in part C, it assesses your ability to identify detailed meaning and opinion in 2 texts on topics of interest to healthcare professionals with any of words. It's about 800 words each. For each text, you must answer 8 4-option multiple choice questions. So the total number of questions in each part: in part A, 20 questions; in part B, 6 questions; in part C, 16 questions. After that, regarding the writing subtest, as you know, you have to write a letter. The letter could be a referral letter, or discharge, transfer, update, like information. So it depends on the task given in the exam and on your profession. The last thing regarding the writing subtest about timing: once the exam or the test started, you will receive these 2 papers. The first one, it's the task, and this is the answer booklet. After that, you will have 5 minutes at the beginning, and in these 5 minutes, you have to read the task, but without using your pencil. So here's you have to read only. You are not allowed to use your pencil and write anything. After that, the next 40 minutes will start, and you can start using your pencil and highlight here, and then start writing your letter. After that, this is the end of this exam. The last subtest is the speaking subtest. At the beginning of this subtest, you will have 2 to 3 minutes for warm-up questions, and there are no marks for these questions. So there are no penalties for any mistakes could happen in this subtest or at the start. After that, the first role play card will be started, and this is the figure of the card, and he's your profession, and this is the role play of the interlocutor or OET representative. Once you receive this card, you will have 3 minutes for preparation, and after that, you will have 5 minutes for conversation with the OET interlocutor or OET representative. So the penalties and the marks will be in this part, 15 in the 5 minutes. After that, this cycle will be you continue again with another roleplay card, the second roleplay card, and again 3 minutes for preparation will be given at the start, and after that 5 minutes for conversation. And this is the end of this subtest. So let's start with the listening subtest. Listening subtest, there are frequent asked questions like how's the listening test scored? Briefly, each correct answer has about or equals 12 points. So to get grade B or score of 350 and above, you have to answer more than or equal and more than 30 correct answers. Regarding the accents used in this subtest, could be Australian, British, American, and other varieties such as New Zealand, Irish, Canadian, and South African. Where do I write my answers for the listening subtest? In part A, you have to write your answers in the space provided, while in part B and C, you have to shade the lozenge or the circle beside the correct answer. Do I need to write down exactly what I hear? In fact, yes, you have to write the same words you hear, and you should not paraphrase the information. You can use abbreviations that are commonly accepted in your profession and which are clear to other professionals. And you will lose marks if you contradict yourself or make your meaning unclear. So that's why I highly advise you that you have to write the same words you hear and should not paraphrase the information. The last thing, you will not be penalized for misspelling, as any reasonable attempt at spelling the correct answer has a good chance of being accepted, because this is a listening test, not a writing test. This slide shows the percentage for each part regarding the weight of answers of questions in each part. In part A, there is the percentage here is about 57%, and in part B, 14%, while in part C, 29. Let's take a brief look on a listening subtest sample. This is the first page of the listening subtest question paper. Here you have to write your data and your signature. And this is the start with the part A. These are questions, the first 12 questions in the first extract. After that, this is the second extract in part A, another 12 questions. And after that, part B, 6 questions from 25 to 30. This is the end of part B, and this is the start of part C. The first 6 questions from 31 to 36, and this is the end of the first extract in in part C, part C, and this is the second extract, the last 6 questions from 37 to 42 questions, and this is the end of the listening subtest. Okay. Regarding the time management in part A, it's very important to know and to know how to use each second, and you have to know the value of each second in this subtest. There will be a time gap between the introduction of each part, in this case part A, and the beginning of the first 12 questions in this part. So the time gap will be between introduction and instructions and the first question. Actually, the record will tell you that you will have 30 seconds to prepare the first 12 questions. Actually, this is not true. You will have more than 100 seconds between the introduction and the start of the record regarding this part. So let's hear a sample.
Occupational English test. Sample test 1. Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now look at the notes for extract 1. Extract 1, questions 1 to 12. You hear a physiotherapist talking to a new patient called Ray Sands. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Come in.
Okay, this is the start. This is the start of the record regarding the questions, the first 12 questions. So as you see, you have more than 100 seconds starting from the introduction about the lesson subtest in general, and after that regarding the part A and this subtest, and you will have 30 seconds, and then we'll start the recording. So I highly advise you that you have to ignore the record once started and go to prepare the first 12 questions, and even you can prepare the first 24 questions. So the whole questions in part A. So let's talk about the tips and methods regarding part A. At the start, once you receive the question paper or the question booklet, read the questions and underline the main item and indicators, and after that, predict the answer. It could be a noun, a verb, or adjective, and you will be able to do that if you know the sentence structure. And we will discuss this topic in the writing sessions, grammar. And you have to do mind mapping. Mind mapping here, I mean that you have to know the meaning for each part in the questions to organize your mind and prepare yourself to listen or hear something you want. And after that, try to prepare the second extract, the second 12 questions as much as you can. Then follow the record and answer while listening. So let's take a sample for part A questions and how can we do this preparation. So the start, underline the main topic or main items and the alarming words or keywords or important information as subtitles. So here, 12 months ago, back injury sustained due to lifting something. So, of course, it will be a noun, something. After that, 1 year ago, sciatica developed. 6 months ago, clear of symptoms. Last month, the recurrence of symptoms. The next main item, patient description of symptoms. So here the patient will talk and describe the symptoms. He's talking about pain, which is located in a certain part of his body. Pain described as adjective. Loss of mobility, problems sleeping, mentioned inability to do something, which is as most frustrating aspect or depressing. After that, here something sensation. Okay, so it's a description or adjective for the sensation. And the location in the calves. General numbness in affected area. After that, the record will talk about the occupation. What's the occupation of the patient? And this is the style or the duties happen in his work. After that, talking about the treatment, prescribed non-steroidal, and after that, application of something. It could be topical treatment, ointment, cream, or drops. I don't know. So it's an application of something. I think it's a topical medication. Maybe provided some relief. Referrals to what? Sports injury specialist for manipulation and exercise program. He's talking about the referral to a specialist. And after that, further treatment, epidural injections, and another medication or another type of treatment. Then electrical impulses. Then decided not to try something patient attributes recovery to, so here's the patient refers the recovery to something. It could be a certain medication or lifestyle modification, I don't know. After that, previous diagnosis, sciatica properly related to something. So this is the cause of sciatica. Okay, so you have to underline the main item. This will help you to follow the record and locating the alarming or important keywords to try guess or predict the possible correct answer. And after that, you will try these tips and methods for the next extract. After that, here's a part B sample. There are 6 questions, 6 MCQs. So this is the start of part B, and of course there will be a time gap, so you have to manage your time properly. And after that, there is a time gap also between question number 25 with 26, and after that with 27, 28, 29, and lastly with 30. So you have to manage your time, and once the record start talking about the introduction, ignore the record and start preparing these 6 questions. So the question structure in part B. The first part of each question is the context. This context helps you or identifies the setting of this case or this question. After that, this is the question prompt. In this case, it's a complete question. So it's a direct or complete question prompt with a question mark. While in this example, it's an incomplete sentence without a question mark. Regarding the answers, could be short or long. Okay. Let's talk about time management in part B. As I told you earlier that you will have a record talking about the introduction and instructions for part B, and a time gap with the first question number 25, and after that there will be another time gap between question number 25 with 26, and so on. Actually, the time gap here is about 55 seconds. Let's hear this sample.
Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a nurse briefing her colleague about a patient. Now read the question.
As you have more than 30 seconds. Actually, it's about 55 seconds, not 30 seconds. The second time management in part B between a question and the next question, in this case, like question number 25 with 26, and after that with 26 with 27, and after that 27 with 28, until the last question, which is question number 30. And here you have just 30 seconds. which is the official provided time or time gap between each two questions.
Hour.
Okay.
So this is the end of question 25.
26.
So, and this is the
You hear the
task.
manager of a care home for the elderly talking to the nursing staff. Now read the question.
Now, a quick word about the...
Okay. This is the context, and this is the question prompt, direct, complete question prompt, and these are the answers. In this case, it's an incomplete question prompt, and these are the answers. Okay, this is a sample for part B. This is the introduction and instructions for part B. And these are the 6 questions. And this is the end of this part. So you have to ignore the record at the start and start reading these 6 questions quickly. And don't wait till the record at the beginning end and go to prepare the first question and then the second question. No, this is totally wrong. You have to write, you have to start reading and preparing the questions once you finished the last question in part A. Okay, let's talk about tips and methods in part B. At the start, take a brief look on the context just to know the setting of this dialogue or this question. After that, read the question prompt and the answers twice. While reading, underline the main idea or main purpose and the alarming or keywords in the question prompt and the answers. Once the record started, ignore the answers. So ignore the answers and you have to repeat the question prompt in your mind, and you have to remember the aim or the purpose of the question prompt in your mind and listen carefully. Repeat the question prompt in your mind and search for the correct answer while listening without reading the answers. Okay. Okay, let's do that.
Now look at question 25. You hear a nurse briefing her colleague about a patient. Now read the question.
Mrs. Green was admitted last night for pneumonia. She came in yesterday with a cough, fever, dizziness, and chest discomfort. She's a healthy 60-year-old with a history of right knee replacement 5 years ago. She's on a regular diet and has no allergies. She's at high risk for falls due to her dizziness. We changed her IV antibiotics to oral, which she's tolerating well. Her assessment is within normal limits, except for some mild shortness of breath and wheezing. Her vital signs are stable, oxygen saturation is 98% on 1 litre, and she's been comfortable during my shift. Around 5:30, I gave her 2 paracetamol for minor pain, with good results. She has an 18 gauge in her left arm.
Yep.
She's got normal saline at 15 mils per hour.
Okay.
Okay, this nurse told her colleague that the patient is not allergic, okay, and he's for high incidence for falling because of dizziness, and she didn't give any information or mentioned that the oxygen may be needed. So the first answer is contradicting what mentioned in the record. It's the opposite. Here the answer, the patient is allergic. Actually, it's not. The second question, the second answer, actually, this is the right of the correct answer. While the T, answer C, question may be needed. No, this is not mentioned in the record. So the correct answer is B. Types of answers. The provided answers could be correct answer or a contradicting answer or not mentioned at all or mentioned but the meaning is either the meaning is too specific or the meaning is too generalized, and both of them are wrong. Okay, so you are searching for just the correct answer which fits what mentioned in the record. So let's practice with the first question. I will start this record and try follow these steps and try to detect the correct answer.
You hear part of a morning briefing on a hospital ward. Now read the question.
Right, so overnight admissions to the ward. Greg, could you start us off?
Sure. We have Sue Deans in bed 5. She's a 54-year-old female who was brought into the emergency department by police overnight. She has a history of poorly controlled paranoid schizophrenia. She presents with chronic persecutory and paranoid delusions and also significant thought disorder. She's to remain in high dependency unit care until the stabilization of her symptoms. We'll be observing her every 15 minutes and monitoring the level of her distress, psychosis, and any response to interventions offered.
Okay, I'll review the clinical and detention status this afternoon. Now, what's the plan for discharge?
Social work interventions required for placement and community support options, and that's been booked for tomorrow. Also, an application for the appointment of legal guardian may be required.
Right. We'll consider that at tomorrow's ward round.
Okay, it's easy to say here that the correct answer is regarding what's the plan for the patient today, not tomorrow, or for discharge. It's the plan for the patient today. It's here emotional state will be carefully observed. Okay. Let's take the next question.
You hear part of an antenatal consultation at a GP practice. Now read the question.
Mrs. Summer, how can I help today?
Well, I just wanted to check something.
Okay. So you're having a home birth?
Yeah, though everyone's on at me about going into hospital. I had my last child there, but I'm determined to be at home this time, to feel more relaxed as well as safe. But I wondered about an at-home epidural if I wanted it. Going without wouldn't put me off, though.
An epidural's out, I'm afraid, because we can't do it without an anesthetist. Just pethidine or gas and air. But they're very effective painkillers.
Yeah, pethadine's good.
And you had a bad patch after giving birth last time.
Yeah, I got really depressed. I couldn't understand it. It was short-lived, though, and I'm better prepared now. It can't be prevented, but I have read up about coping strategies.
Okay, this record, you hear that the GP mentioned or highlighted about the home birth, but he didn't advise anything about this method of delivery. And regarding the next answer, ways of avoiding postnatal depression, yes, the patient mentioned about depression postnatal, but they didn't mention any ways to avoid that. The last thing, what painkillers might be available during labor, and this is the correct answer. He talked about helpful painkillers, so this is the right or correct answer. The last question for practice.
You hear a trainee doctor telling his supervisor about a problem he had carrying out a procedure. Now read the question.
So how's today gone, Harry?
Well, I'm afraid I had a problem taking blood from Mrs. Harris. I've done that procedure numerous times now, so I wasn't particularly worried. What I hadn't anticipated was the difficulty finding a vein. I suspect her illness means she'll have had a number of cannulas inserted over the weeks she's been here, and that's led to collapsed veins.
Well, that can happen with long-term elderly patients, and it's distressing for them if the procedure isn't done quickly.
Oh, I mean, she endured it without a murmur.
Oh.
I'm sure I would have made a fuss in similar circumstances.
Well, I'll supervise you the next time you do it.
Okay, in this question or this record, the attorney mentioned that the patient had lots of cannulas in his vein or her vein, so the vein is collapsed. Regarding the patient's negative reaction, he didn't mention anything about that. Inappropriate equipment, no, actually the attorney have done this procedure many times, and of course the equipment is working very well. So the correct answer is treatment administered previously. Hands up if you got 3 correct answers. Okay, the last thing regarding part C sample, this is the introduction of part C, and these are the first 6 questions. Time management in part C. Let's go back for next previous slide. Here there will be a time gap between the introduction and the first question, but there is no time gap between this question and next question and next question and next question and so on. So the provided time gap is just between the introduction and the start of all these 6 questions. So in this part, you will have 90 seconds, but actually it's not just only 90 seconds, you will have more than 2 minutes. Okay, more than 2 minutes to prepare these 6 questions. So you have more than enough time to prepare these questions, but the challenge here is the first one. You have to read the answers and listen in the same time. And another thing, or the next, another important thing, you have to follow the record carefully, because there is no pause between each question. So once the record started, it will continue till the end. There is no gap, no pauses between the questions. So you have to know the record talking about which question. Okay. So regarding time management, part C, between the introduction and the first question, you will have, I think, 135 seconds.
Part
Let's
C.
see.
In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1, questions 31 to 36. You hear an interview with a cardiologist called Dr. Jack Robson, who's an expert on Chagas disease. You now have 90 seconds to read questions 31 to 36.
So the time is still running, so you have enough time to prepare the 6 questions, and simply ignore the record at the start and start preparing directly. Okay, and here we are waiting till the record regarding the first question, or the record for the whole 6 questions started.
Today we're
Okay. Regarding time management between the questions, there is no time given between questions. Okay, so be careful. You have to read the whole 6 questions and prepare them carefully and properly before the record started. Part C, tips and methods. Again, this is the question prompt, and these are the answers. You have to underline main idea and indicators, or the keywords or important information. Then listen to the record and read the answers while listening. But regarding the question prompt, you have to remember the question prompt and repeat it in your mind. So don't read the question prompt while listening. You have to read the answers only while listening. Okay. Regarding the swinging, I mean that you have to listen. Sorry. You have to listen to the record and read the answers in the same time, and this is very hard to be applied. So briefly or quickly, you have to listen to the record and read the answers, listen to the record and read the answers, listen to the record and read the answers. This is what I mean by swinging. And again, you have to remember the question prompt in your mind, then read answers and listen. So I didn't say that read the question prompt. No, you have to remember the question prompt in your mind. You have to read the answers only and listen to the record carefully. And after that, exclude the distractors or the wrong answers while listening. Then detect the correct answer. Again, the provided answers in part C, it could be correct answer, a contradicting answer, or not mentioned at all, or mentioned but the meaning is too specific or the meaning is too generalized, and both of them are wrong. The correct answer, this is what we want. This is a sample of part C question. Please read the question prompt. Dr. Thompson says that that concerns over charges in the USA are the results of concerns over charges in USA are results of. The first answer arise in the number of people at risk of being infected with the disease. Arise in the number of people at risk. B, a greater awareness of how many people there have the disease. A greater awareness of how many people that there have the disease. And C, an increased prevalence of the insect which carries the disease. Listen to the record.
Right, I see. And are there any concerns in the USA about shell gas?
Yes, the insect carrying the parasite is actually endemic to the southern U.S. states. Since 1955, however, no more than 30 people have been bitten and infected while in the USA. The alarming thing, though, is that it's become apparent that large numbers of first-generation and some second-generation immigrants from Latin America carry Chagas, around 300,000.
Right.
These people won't infect others, apart from congenitally and possibly through blood transfusion, but a significant proportion end up chronically ill.
And for the...
Okay, I hope you got the correct answer, but listen again with reading the transcript.
Right, I see. And are there any concerns? Right, I see. And are there any concerns in the USA about shell gas?
Yes, the insect carrying the parasite is actually endemic to the southern U.S. states. Since 1955, however, no more than 30 people have been bitten and infected while in the USA. The alarming thing, though, is that it's become apparent that large numbers of first-generation and some second-generation immigrants from Latin America carry Chagas, around 300,000.
Right.
These people won't infect others, apart from congenitally and possibly through blood transfusion, but a significant proportion end up chronically ill.
And for the...
Okay. Let's take each answer. Here arise in the number of people at risk of being infected with the disease. Read the paragraph of the talk. Yes, the insect carrying the parasite is actually endemic to the southern US states since blah blah. However, no more than 30 people have been bitten and infected while in the USA. So the data or information mentioned in this part is contradicting what mentioned in the first answer. So because the first answer is telling us that there are a rise in the number of people at risk of being infected with the disease, while what mentioned in the record, it's actually endemic to the southern USA since, however, no more than 30 people have been bitten and infected while in the USA. So there is no rise in the number of people at risk of being infected with the disease. So this is the opposite of here. If we continue, the alarming thing though that is it's become apparent that large numbers of first generation and some second generation immigrants from Latin America carry Chagas around blah blah blah. There is no any information is fitting with what mentioned in first answer. After that, these people won't infect others apart from congenitally and possibly through blood transfusion, but a significant proportion end up chronically ill. And also, there is no any information or data mentioned fits or fitting here. Okay, let's go to the second answer. A greater awareness of how many people there have the disease. Obviously, there is no data matching with this part, and while here the alarming thing, which means concern, is that it's become apparent that large numbers of first generation and some second generation immigrants from Latin blah blah blah. Here the meaning of this answer, a greater awareness of how many people there have the disease. Alarming concern, become apparent of that large numbers of first generation. So the meaning of this part is just like the same meaning of here, a greater awareness of how many people there have the disease. But here there is paraphrasing to that meaning. While the last answer, an increased prevalence of the insect which carries the disease. There is no data mentioned in these three parts matching what mentioned in this answer. So this is contradicting. Correct answer, not mentioned at all. So this is the correct answer. Do the first facial sample and the second one, and try apply our tips, methods, and strategies which mentioned in this session, and good luck.